Virgin Islands veterans, I'm standing here on Veterans Drive, built in honor of us, Virgin Islands veterans. But we now must do our part to bring more VA medical benefits to our shores. How can we do that, you may ask? Get on www.va.gov and get registered. This is the way that we can do our part. Get registered at www.va.gov. We're counting on you.
Hey students, this is Governor Albert Bryan Jr. One of my favorite things to do is read. A good story can fuel the imagination and introduce you to places and characters you've never seen or heard of before. This summer, I'm reading 5 books, and I'm challenging students in grades K through 6 to do the exact same thing. Take my summer reading challenge and read 5 books. Choose from the books you have at home or log on to read5.org for a super selection of books you can download for free. Keep track of all the books you've read and submit the tracking sheet online at read5.org or when you return to school. My summer reading challenge ends on September 3rd, 2021. Read 5 or more, you meet the challenge, and you get invited to my big celebration. Stay safe, be good, and read 5.
Vaccinate yourself, like we go. If you from the VI and you want to get vaccinated, put your hands up high. The life you save might be your own. If you from the VI and you don't get vaccinated, put your hands up high. Be vaccinated and proud. So get the vaccine now, so we can gather with our friends and family together, so we can start back school and full the classroom, so all the kids them will learn better. Get the vaccine now. There's only one way for us to create a herd immunity in the United States Virgin Islands. Get your vaccine. Starting July 9th, the United States Virgin Islands government is giving away $100,000 every week for 10 weeks. Only Virgin Islands residents who are fully vaccinated against COVID-19 are eligible. If you've only got part of the vaccine, you can also win $50,000. Take your best shot. Let's put the community first and win big. Vaccinate yourself, like we go. Vaccinate yourself, like we go. If you from the VI and you want to get...
Weekly press briefing and COVID-19 update for the week of August 23rd, 2021. I am Lieutenant Governor Tregenza Roach. Governor Albert Bryan is presently out of the territory. Joining me for today's update is Territorial Epidemiologist Dr. Esther Ellis, who will provide both our vaccination report and the winners of this week's Vax to Win lottery. Before I go to Dr. Ellis this afternoon, however, I would like to extend my heartfelt condolences to the families and friends of the 9 Virgin Islanders who have died from COVID-19 since our last update last week, Monday. May they be comforted in these difficult times and be encouraged even more now to stay safe and well. The passing of these 9 Virgin Islanders is a solemn reminder that we are still in the vice grip of this pandemic and that we must continue to take every precaution to keep ourselves and one another safe. Now, please welcome Dr. Ellis, who will provide us a full update on the vaccine administration in the territory and who will also comment on the recent FDA full approval of the Pfizer vaccine. Good afternoon, Dr. Ellis.
Good afternoon, and thank you, Acting Governor Roach. As of August 24th, 2021, a total of 162,685 tests have been conducted in the territory. Of those tests, 5,638 individuals have tested positive, and 157,047 have tested negative. The 7-day positivity rate is 4.54%. There are currently 261 active cases in the territory, 163 on St. Thomas, 81 on San Croix, and 17 on St. John. A week ago, we reported 41 fatalities. However, there have been 50 fatalities total as of yesterday. We've lost 9 more community members to complications from COVID-19. The most recent person was a 64-year-old female on St. Thomas. None of the people that died were fully vaccinated. With each death, I am saddened. We can prevent more deaths by using the best tool we have against the virus, the COVID-19 vaccine. Commissioner Encarnacion and I would like to extend our deepest condolences on behalf of the Health Department to the family and friends that have lost loved ones to COVID-19. We must all continue to do our part to reduce community spread and spread among close contacts. If you have had close contact with someone with COVID-19, or you are experiencing symptoms such as runny nose, fever, cough, headache, tiredness, sore throat, loss of taste or smell, diarrhea, or other symptoms, you should stay home and away from others and call the epidemiology hotline to report your symptoms and set up a COVID-19 test. The hotline is open 7 days a week from 8 a.m. to 10 p.m. for callers to report suspected cases at 340-712-6299 or 340-776-1519. From our hospitals, the Governor Juana Fleury Hospital and Medical Center reported 9 COVID admissions with 5 patients ventilated, and the Schneider Regional Medical Center reported 15 COVID-19 admissions with 2 patients ventilated. Of the 24 patients hospitalized, none are fully vaccinated. The vaccines are working by reducing infections and preventing severe illness and hospitalizations. Our hospitals continue to admit unvaccinated individuals with serious illness despite us having the tools to avoid this. We are seeing decreased hospitalizations but increased deaths, and many of our hospitalized patients are ventilated. This shows how dire the situation is. We continue to administer monoclonal antibody treatments to decrease hospitalizations in unvaccinated individuals. Access to this life-saving treatment has helped many Virgin Islanders with mild to moderate COVID-19 who are at substantial risk for progressing to more severe illness or hospitalization. So far, we have administered 462 total monoclonal antibody or MAB infusions at Schneider Regional Medical Center. This includes Myra Keating Smith Community Health Center on St. John. 171 of those have been conducted in August thus far. 103 total monoclonal antibody infusions have been conducted at Juan F. Fleury Hospital. 42 of those have been conducted in August. On Monday, the U.S. Food and Drug Administration granted full approval to the Pfizerkovit19 vaccine for people aged 16 and older. This is the first coronavirus vaccine fully approved by the FDA. The Pfizer vaccine for children aged 12 to 15 is still being offered under emergency use agreement. About 170 million people in the United States are fully vaccinated against COVID-19. And out of that, more than 92 million have received the Pfizer vaccine. In the U.S. Virgin Islands so far, 49,919 individuals have received at least one dose of a COVID-19 vaccine, and 40,872 individuals are fully vaccinated. The vaccine is safe and works to save lives. I am hoping that many of you who are waiting for full FDA approval take this opportunity to get vaccinated. People who recover on their own from COVID-19 can and should immediately take the vaccine after recovery. There is no need to wait a certain amount of days to get the vaccine after you've recovered on your own. Those who have had monoclonal antibody treatments can get the vaccine 90 days, about 3 months, after receiving the treatment. Vaccination is one of the greatest public health achievements in the 20th century, which has helped to build a society free of vaccine-preventable diseases and save millions of children and adults across the globe. The COVID-19 vaccine is one of those vaccines that is working against a preventable illness that can continue to save lives during this pandemic, and everyone has access. Currently, there are 3 types of vaccines being administered in the territory. The Pfizer and Moderna vaccines are 2-dose vaccines. The Janssen vaccine is a 1-dose vaccine. National news outlets have reported that booster shots have been approved for immunocompromised individuals. This is limited to the Pfizer vaccine only for now, and the department will alert the public when federal approval from the FDA and CDC is issued. This past week, the CDC ACIP recommended that people whose immune systems are moderately to severely compromised receive an additional dose, and this is 4 weeks after the 2-dose series is completed. And this is because emerging evidence shows that some people who are immunocompromised experience reduced immune response to the initial vaccine series. And this update aims to prevent serious and possibly life-threatening COVID-19 within this population. To get vaccinated, please call 340-777-8227 or simply walk into any of our community vaccination centers. You can also schedule an appointment online at covid19usvi.com/vaccines. Families can call the hotline to schedule an appointment for homebound relatives as well. Our mobile strike team will come to the homes of homebound individuals. If you are the parent or a guardian of a child aged 12 and up, please make sure to accompany the child to his or her vaccination visit and bring an ID for both the child and you as well as the child's birth certificate. We currently have expanded daily drive-through testing that prioritizes testing for those that are sick or a close contact of a positive case. To schedule an appointment for COVID-19, call the EPI hotline, those numbers were given previously, or schedule your appointment online, covid19usvi.com/testing. Pop-up testing on St. John is available at the Vipa Gravel Lot on Wednesday from 1 to 4 p.m. While waiting to be tested, you should remain at home and avoid contact with others. This is crucial. We are seeing more individuals not quarantining when they are either COVID positive or a close contact of a COVID case. You must quarantine for a minimum of 10 days if you are sick and 7 days if a close contact, even if you test negative before day 7. As a close contact, do not try to get tested before day 7. Many individuals are also trying to get tested immediately after exposure. However, remember, there is an incubation period for this virus. After you've been exposed to the virus has to incubate in your body for days before you would test positive, which is why 7 days is the earliest you can test out of quarantine if you're not sick but a close contact. Also, we have been seeing employers require a negative test to return to work. Per DOH guidelines, a negative test is not required to return to work. All quarantine is time-based and in line with CDC guidelines. Individuals can test positive for some time after recovering from COVID, and a positive test result does not mean they are still infectious. And lastly, a big congratulations to our vaccine lottery winners. The St. Thomas winner is Nita Sukani, who won $100,000. Congratulations. Our San Croix winner is Yuli Gonzalez, who also won $100,000. Don't forget the Healthcare Heroes special drawing will be held on October 4th, and the last day to register a healthcare worker, you can register for this special drawing at www.vax2winusvi.com. To keep up with the latest information, please visit the U.S. Virgin Islands Department of Health Facebook page or our website at www.COVID19usvi.com. And for COVID-19 health information alerts, text COVID-19 USVI to 888-777. Thank you.
Thank you, Dr. Ellis, for such a thorough and thoughtful and comprehensive COVID-19 report. It is good news to hear that the Food and Drug Administration fully approved the Pfizer vaccine against COVID-19 for individuals 16 years and older. This is certainly a welcomed development in our continued fight against the spread of this virus, and news that I hope will be the deciding factor for many Virgin Islanders who are still on the fence with regard to the vaccine. For those persons who were hesitant to take the vaccine, we hope that this approval will give you additional assurance to get the vaccine. If you haven't done so already and are considering, you can schedule your appointment to get the vaccine by calling the numbers already provided, 340-777-8227, or by visiting the Department of Health's website, COVID19usvi.com, or by TEMA's website, vitema.vi.gov. In other COVID-related news this afternoon, the Virgin Islands Bureau of Internal Revenue and the Department of Finance will begin paying out this week the child tax credit advances to eligible Virgin Islands families. The tax credits, which total $1,500 per minor child up to 17 years of age to each taxpayer with minor children, will be paid in 5 monthly installments of $300 per child, starting in August and continuing to December 2021. The first payout of $3,757,935 is based on an initial determination of 8,555 eligible taxpayers. The number of taxpayers may increase as others are determined to be eligible. As Dr. Ellis has provided the Vax winners, I just wanted to share that we are now in the week 6 of the Vax to Win vaccine lottery, where 2 vaccinated Virgin Islanders will be eligible to win up to $100,000. This past week is the first time we have had a winner who has had only 1 shot in their vaccine series and so qualified for $50,000. And so we have decided to utilize the other $50,000 to award other vaccinated individuals. We will not have any rollovers, so we will be awarding 5 lucky winners, 2 from San Croix, 2 from St. Thomas, and 1 from St. John. Remember, the Pfizer vaccine is now fully FDA approved, so you too can take your best shot and win the lottery. Thank you, Dr. Ellis, for providing the winners of the lottery. And congratulations again to this week's winners. Thank you for taking your best shot and for doing your part in protecting our community, especially our school-based personnel, as they play a critical role in ensuring that we can get our students and teachers back in the classroom safely. Now, before I go to the press with any questions for today's press briefing, I just wanted to share a couple of thoughts from a conversation I had with a young lady this week. And she asked me what things are top of mind as I and the rest of the government leaders, headed by our Governor Albert Bryan, continue to deal with COVID in the territory. And although there were many things to mention to her, these three things I shared. One, we ought to be very, very concerned about the well-being and the health of our healthcare workers. These are the people who take care of the sick. And many times they're not top of mind as we decide whether we're going to take a vaccine, whether we have a personal choice to do so, whether we're going to move in our community knowing that we are COVID positive, knowing that we're not choosing to follow social distancing or the hygiene protocols. Keep in mind that these people who take care of the sick can also be sick. And they're not always going to be there available to take care of us if we have the unfortunate experience of having to need their care in our hospitals. So I keep those persons top of my mind always. In addition to that, just recently, one of the Moravian ministers made a reference to the loss of the wisdom generation of Virgin Islanders. And by that, he was commenting on the loss of life in the area of our population of persons above 75 years of age, persons in their 80s, persons in their 90s. These are some people who are the core of our society, who inherited directly the values from our ancestors gone on, and who have kept us grounded as we have endeavored to promote the special place that we are privileged to call our home. And the loss of this generation of persons should be of critical significance to every Virgin Islander. And thirdly, top of mind are the children of the territory who are now entering what will be the third school year without being in class, without having the regular social interaction with their peers. And if we are to get them back to any sense of normalcy in terms of their education, it is critical that we do every single thing we can to bring this pandemic under control. And so I urge you to continue to be safe, to know that in being safe, you are protecting yourself and you're protecting every other Virgin Islander, and to do everything you can that is within your power to contribute to curtailing the effects and the impacts of this devastating disease, which means getting the vaccine, now that we have a vaccine that's fully FDA approved, and continuing to practice every protocol to keep yourself and one another safe. And so now we will move to the press portion of our briefing and to solicit and engage questions from the media community. I think Mr. Gilbert of the VI Consortium has the first question.
Yes, good afternoon, Lieutenant Governor Roach.
Good afternoon.
Yes, a few questions. First, Governor Roach, you mentioned the governor was out of the territory. How long has the governor been out of the territory?
I think the governor left the territory on the 16th. He will return on Thursday, the 26th of August.
Okay, so I suppose over a week ago or so, we didn't receive any notification of that. The reason I'm making a point of that is, this has happened in the past. The government house is rather sporadic in how it notifies the territory relative to the governor's whereabouts, especially when he's out of the territory. And of course, we're not seeking specifics, but if the governor is out of the territory, something happens, we did not even know if you were acting lieutenant governor. I'm not sure if you know what happened there, why we weren't notified.
Uh, it is my practice whenever I leave the territory to put out a press statement regarding that departure. I can't really speak to whether the governor did that. I know that what is required of the governor when he departs the territory is that he notify me and I in turn notify the president of the legislature. Because I will serve in the acting capacity and the president of the legislature will serve as acting lieutenant governor in those instances. What I can say to you is that I will bring your concerns in that regard to the governor when I engage him on his return on Thursday.
Thank you, Lieutenant Governor. Another question, and this one, of course, this one is regarding crime. Just about just before 11 a.m. today, there was a homicide on San Croix. Last week, there was a woman was found decomposed. I'm sure you are aware of multiple reports of armed robberies across San Croix and just violent crimes across the territory. Haven't heard from the new commissioner nominee, not a governor, on this. Have you had discussions relative to the wave of criminal activity we are seeing right now?
Mm-hmm. Well, I would say to you that we all are concerned about crime in the territory. It just seems so counterintuitive that at a time when all of our efforts are directed at trying to keep our people alive and safe from a pandemic, still others use the opportunity to engage in criminal conduct. I will say to you that just this morning, I did speak with Commissioner nominee Ray Martinez, who apprised me of the incident that you speak of today, that the department is actively investigating those incidents, and I am certain that there will be press conferences coming out from the VIPD as to efforts going forward to address some of these issues. He did discuss with me one initiative that I believe is in too early the formative stages to comment on it right at this moment, and I hope that you will appreciate the sensitivity that such an instance requires.
Yes, sir. Thank you. Lastly, the governor said last week we had seen an uptick in vaccinations there, and those vaccinations followed the recent surge of cases we had. I think there were 1,200 new vaccinations. We didn't quite get a percentage from Dr. Esther Ellis there. If we could get an update as to what we are seeing. So, of course, we had the FDA approval of the Pfizer vaccine on Monday. What I would like from her is the latest percentage relative to vaccination in the territory, as well as the percentage of Virgin Islanders who have taken the FDA-approved Pfizer vaccine.
Okay, thank you. I will ask Dr. Ellis to comment on that question, and then I'd like to also make a comment when she's through. Dr. Ellis?
Thank you for that question. It's very detailed, so I can at least answer the percentage of Virgin Islanders that are vaccinated. And then if I cannot answer based on the data that I have in front of me exactly how many individuals received the Pfizer vaccine, I can get that to you later. But so far we have administered, a total of 51,696 first doses, 40,413 second doses. For fully vaccinated, that is 45.7% of our population. And if you look at fully vaccinated 18 and up, that's 48.3%. If you look at fully vaccinated for our elder population, it gets higher as individuals get older. As far as how many individuals have received Pfizer, I do have that. Now the total doses administered of Pfizer have been 64,905 doses. That's compared to Moderna has been 26,139.
Thank you, Dr. Ellis.
Thank you, Dr. Ellis. And Mr. Gilbert, I just wanted to add, yes, we meet regularly, the COVID task force, in the mornings, and we look at the numbers, and we have seen an uptick in the vaccine counts. I wanted to also take a moment to personally thank the former Lieutenant Governor, Oswald Potter, his brother, Milton Potter, and Senator Milton Potter, and his brother, Attorney Everett Potter, for an amazing response to their brother's death, a community response to their brother's death, for providing such an excellent, thoughtful, emotional, grounded editorial in the Daily News and encouraging persons to take the vaccine. They ought to be commended for that. And I think what is happening is these deaths are really hitting home. You know how integral, how connected the US Virgin Islands and the British Virgin Islands are. And I think that magnifies the impact of these losses. And I believe that has contributed to a vaccine uptick. I really wanted to publicly thank Lieutenant Governor Potter and his family, and to extend, my condolences as they mourn the loss of their brother to COVID-19. Thank you.
Lieutenant Governor, thank you.
Thank you. We have Diana Diaz online. Ms. Diaz?
Yes, good afternoon, Lieutenant Governor Roach. I really just have one question, and it applies to nursing homes. Do we know if nursing homes are going to be under a vaccine mandate? And if so, what are the plans to enforce the policy?
I would say to you that the discussion of a vaccine mandate has been a part of our conversations recently and in the recent past. What the governor had instructed of the VI Department of Justice was to do some preliminary research about vaccine mandates in the light of not having a fully approved vaccine. Now that the circumstances have changed, where there is now a fully approved vaccine, I believe the stance of the government may change. I am not prepared at this very moment to tell you that a decision has been made in that regard, but I will tell you that we expect to receive the comment of the Attorney General very shortly, and that the decisions about such requirements, such mandates, will be made considering the vulnerable populations and facilities where such measures might be most critically needed.
Thank you very much, Lieutenant Governor.
Thank you. I believe that's it in terms of the questions from the media. Again, I just wanted to thank everyone for sharing the time with us this afternoon. Please encourage someone to get a vaccine. Some people are afraid. We're not going to get 100% compliance. I think we can safely assume that. But there are people who are just afraid. I have myself accompanied friends and others to the vaccine centers just as to provide a sense of comfort and a sense of encouragement. So please continue to do so. Because some people do need the encouragement. Some people are not just anti-vaccine. They do have a fear about putting something into their body that they do not know the components of. And sometimes they need a little stroking, a little bit of encouragement. So please do that. Please continue to keep yourself safe, and in so doing, knowing that you keep other people safe and that you have the gratitude of the entire community of the Virgin Islands. Thank you. God bless each and every one of you. God bless the Virgin Islands.